Hello everyone, this is Chloe Mabbott here from Four Amigos Animal Therapy. I wanted to make this video based on the requests of some of you on canine lameness identification. So this is based at owners, and it's just to try and give you some really simple hints and tips about what to look for. This is a two-part series, so there's also an equine version as well. So if you're interested in that, then go check it out. So firstly, I want to talk to you about what lameness actually is. As for the layperson, that can be a little bit confusing. I want to talk about how we grade it, so how we basically establish how bad the lameness is, and what the signs we look for when we assess lameness. And that's what's going to really help you guys out looking at your dogs and trying to establish if what you're seeing is normal or whether it's starting to show signs of potential pain and underlying pathology. So what is lameness? There's lots of different definitions of it, as you can see on the slide. Often what you guys end up seeing when you really notice it is a limp, but that's usually when there's quite a bad problem arisen, and there's quite a lot of pain evident. But lameness is a symptom or a clinical sign of underlying pathology. That's the key thing to remember, that they're not limping for no reason, or they're not lame and showing an asymmetrical movement for no reason. Equine lameness has been defined as an alteration in the animal's normal stance and or mode of progression caused by pain or mechanical dysfunction. Now that definition is from 1988. And there was another one in 2008, which is alteration of the normal gait pattern as a result of functional or structural disorder of the locomotor system. So both of them have the same thing in mind, that it's an alteration of normal movement due to something underlying in the locomotor system, which is our musculoskeletal system, so our muscles and our bones, our joints and tendons and ligaments. It also often, as I said, can result in something like limping, for example, and it is often an indication of, as I said, something structural or functional going on, and it can be in just one limb or it can be in multiple limbs, but it can also be in the back, for example, and that causing the problems with movement, which is why it's really imperative to get a vet involved if lameness is suspected, because they're the only ones that can officially diagnose and have all of those diagnostic techniques to try and establish exactly where it's coming from, because if you know where it's coming from, you can try and sort the problem. And what a vet will do is they will give a lameness evaluation, they'll give an assessment, they'll try and establish where the pain is coming from, and they'll often give it a score. So they'll give it a grade, essentially. This is from Carr and Dicus in 2016, but there are many different scales that exist. They're all based on the same thing, though. They're trying to establish a system as to how bad it is, from the mildest, aka being either no lameness at all or very, very mild asymmetry, up to complete non-weight bearing ability to sort of stand type lameness. And obviously it does depend on whether they have one limb or multiple limbs as to how that might look like to you. Obviously, if they had a non-weight bearing lameness on all four legs, that is paralysis, and there's normally a spinal pathology associated with that, and it looks much worse to you, but they can still have a grade 6 non-weight bearing lameness on one limb. So as I said, there are different systems that are out there, but they're all based on the fact the lower the grade, the milder the lameness is. So it can actually be incredibly complicated doing lameness assessment, and actually even vets don't always agree with which limb they think is lame. But there are some simple hints and tips that we can sort of look for. So although this might look complicated, it's actually quite a nice diagram of something quite simple that we can sometimes utilise. So this is showing an animal that is right fore lame and during trot, and what it's basically showing is head movement. So what you can essentially see here is when the right forelimb is down in stance, the head is raised slightly more than when the left forelimb is down and in stance. And that's just quite simple body biomechanics, that what they'll do is they will keep their head slightly raised during the lame limb stance to try and lift their body weight off it a little bit and take some force off it. And they'll put more onto the other side, onto the sound limb, to put more weight on that and take more of the strain. We can get really complicated with lameness assessment using things such as kinetics and kinematic variables. Kinematic is things like stride length, tracking distance, joint range of motion, that sort of thing. Whereas kinetics is looking at forces, things such as vertical ground reaction force or vertical acceleration. Now, we're not going to quite go that complicated, but those things underpin this simple thing that you guys can utilise, such as looking at the head nod. So as I said, I really want to try and make this simple. So one thing that you can look at is if it's a clear and obvious forelimb lameness is that head nod, as I said. And if you can remember this simple thing, it will be down on sound. Now, it's not always that simple because it could be coming from the hind limb, for example, and in trot, what can occur is, for example, if the left hind limb was lame, because trot is in diagonal pairs, so they would move left hind and right fore together and right hind and left fore together. If the left hind was lame, they'd actually lower their head slightly on the right fore stance, because as the left hind, which is the painful limb, is loading, they're throwing their weight forwards onto that right fore to take the pressure. But that's not always that simple, because it does depend on if it is a swing phase lameness, aka the pain is occurring as they physically swing their leg, or if it's a stance phase lameness, aka the pain occurs when they're loading their leg. And there can be different types of that lameness depending on what the underlying pathology is. So we don't want to get that complicated. We just want to get you to notice signs of potential issues. So as I said, the asymmetric head up and down is one thing that you can look at. Other things that you can look at is simply comparing the limbs to each other. So compare your two forelimbs together and your two hind limbs together. Do they protract the same? Now, protraction is your forward motion. So do they both equally go forward as much as each other? What about their flight of arc, aka how much they lift up during movement? Are they both lifting up as much, or is one leg, for example, like the left hind toe dragging and the right hind not? Also look at your changes in musculature. Are both your forelimbs equal in muscle and both your hind limbs equal in muscle? Do you have a lot more muscle in the chest compared to the hind limbs, and vice versa? Movement should also always be on two tracks. So the left hind and left fore should follow each other in a straight line, and the right hind and right fore. Is that happening, or do they have a slight sway like this? Or are they essentially swinging their hind limbs out and back in? Same with the forelimbs. Is there anything deviating like that? And also you can look at, does their trunk sway or their hips sway? Do they get a sway in their movement that sort of look like they're waddling? Now, it's not up to you to establish that they're lame and where. You just simply need to check that they are not correct and go to your vet. Or if you've already got a therapist, speak to your therapist, especially if the changes have occurred between you've last seen them and now. But a good therapist should obviously help you notice these signs, and that's why it's also really important to have regular therapy for your animals without pathology, so you know what's normal as well. And then your vets obviously can help you out. But any of these movements, even if they've always done it from a young animal, that could mean that they've had something growing up that has always been there. Do go and get it checked out. I've also put a link here to a lameness trainer video which has been made by a vet, looking more in depth at some of these things that we've talked about. If you want to know any more, it's really helpful. Okay, so I wanted to now try and put some of these things into practice and show you some of the things I've told you. So this was my partner's dog Bella. She was a 10-year-old British Bulldog, and she did have a diagnosed pathology. So if you watch her, she comes around this corner, what you can see is that she is trying to put her head down onto that left fore, which is showing that she's offloading her right fore. Even if you find that a little bit difficult to see, you can see that as she moves, it looks like she's waddling down like this. And therefore you can still notice that something is wrong and take them to the vet for further investigation. She actually had arthritis in her right elbow, which is why she's trying to offload that and put more weight down onto her left foot. So now this is my current dog, B, and if you follow me on social media, you'll probably have seen stuff about her previously. But what I wanted to show you with her is how she moves a little bit differently to some other dogs you might see. Remember that when I'm asking about is this dog lame as well, that lameness is to do with basically any asymmetry in movement caused by an underlying problem. So she does have an underlying problem, which I'll explain in a minute. It doesn't necessarily mean pain. This is where you need to get vets involved to truly understand what it means. But if you watch her here, it is a quick video, but essentially what she is doing is she's doing something called pacing. So instead of either walking normally, where you would start with the left hind to initiate in the movement and then the left fore, and then the right hind followed by the right fore, or trot where it's diagonal pairs, aka left hind right fore or right hind left fore, she's doing left hind and left fore at exactly the same time and right hind right fore at exactly the same time. Watch that again. See, they're both happening at exactly the same time. And then if you watch from behind, you can see she gets a real sway on with her trunk and with her hips. What she's essentially trying to do is to not flex her stifle. Now her stifle joint is here, and it's the equivalent of the human knee. And what she's got is something called patellar luxation, and it's bilateral, so in both hind limbs, which is where essentially her kneecap comes out of place, out of its little ridge that it has to sit in, which causes their stifle to get stuck up in hyperflexion. She's not showing that happening here, but she doesn't want to risk that happening, so she tries not to flex her stifles too much and therefore waddles with her hips, and it's easier to do that when pacing than when walking properly or trotting. So if you watch that again, pacing, and then really look at that sway from behind. And finally, I've got this dog, which is, it's a very short clip, but what we'll see as she goes along is that her left hind is staying in that hyperflex state. So this is a really severe case of patellar luxation. It's essentially because the kneecap's coming out of alignment, the patellar tendon gets stuck over the wrong side of the femur, and it means that they can't re-extend their stifle back, so it stays hyperflexed. That's a really obvious sign for you as an owner to note something quite that obvious, that they're holding the leg. She does this very regularly, and it's something that obviously would need vet intervention to be able to sort out. We can do physio to try and strengthen the quadriceps muscles around that and try and pull the tendon and the patella back into the right place. But ideally, you would, again, notice anything like this, you would need to see a vet about it to really understand what's going on, whether there's any pain behind it and what can be done. So hopefully that's been helpful to you, just to see some really obvious lameness indicators, but also some really mild ones that a lot of people wouldn't think of noticing a dog pacing like that as being a potential sign of pathology or swaying their hips like that, but it's something that you should always pay attention to and talk to a vet or therapist about. Just to give you some tips as well to try and help you with this, make sure you look at all angles if you suspect something. So cranial is looking from the front, cranium is your head, so looking from the head direction, lateral from both sides, and caudal, so from behind, for full view as to what's going on. You can also look from above with the dog because they're small. Take videos, you can see them constantly, you can show vets what you're trying to show them, and if you use slow-mo mode, if your phone has that, like iPhones do, it's really helpful. You can slow it down and see exactly what's going on. Try to establish if it's chronic changes, okay, have they been there for a long time or are they new? Have you always noticed them basically, or how long have they been going on for? Remember the head nod trick, as I said, so like I showed you with Bella, down on sound for a forelimb lameness. If a hind limb is suspected, you can look at pelvic movement, but that can be quite difficult for the lay person to see, the average owner, so how much their pelvis is moving. So try and look at simple things such as whether their hind limbs are protracting forwards equally and retracting forwards equally, whether they toe drag, for example, how they flex their joints up through the movement, just really using each side to focus on and look at that truncal or hip sway. Multiple lamenesses take a really long time to train to see. Even vets, as I said, use nerve blocks to decipher, and there is arguments between vets about getting the same answer as to where the lameness is and which limb is lame. So it's not your job to establish where the lameness is, and even what leg is lame, just that there is something not quite right, and go to your vet about it. Hopefully this has been really helpful. If you have got any questions though, please feel free to contact me on my social media pages at For Amigos Animal Therapy. I've got Facebook and Instagram, and I'll be happy to answer.